Okay, there we go. So you're live. All right, there we are. YouTube, folks, sometimes it just goes haywire. So I'm Dr. Rayfidge, Vet Triage, a bit late with today's stream, July 30th, 7:48 p.m. Pacific time. And anyway, better late than never. What are you going to do? And I'm still trying to decide what the best time for these live streams are anyway, because we don't get really that many audience members during it right now. So thank you those in the playback crew that watch, and please folks subscribe, hit like, donate, all the things. So we're going to talk about limping in animals. This is dogs and cats, but it can apply to any species that has legs. And the more detailed explanation of this is on my channel. If you look up or search lameness, I think, or limping, it goes over in more detail what causes limping in animals. But we'll go over it more brief here in this context, keeping in mind, of course, that consultation with a veterinarian, either in person or with vet triage, is always recommended to figure out why your pet might be limping. Is it an emergency or not? What can you do about it? What can you expect your vet to do? All that stuff. There's three broad causes of limping in dogs from an anatomical standpoint. Number one is orthopedic. Number two is nervous system. Number three is soft tissue. So when you think about orthopedic, you're thinking about like bones and joints. So the orthopedic, the skeletal system. The nervous system, you're thinking about the nerves or the spinal cord that innervates the limb. And then for soft tissue, you're thinking about the non-bony and non-nervous system tissues. So the muscles, for example, would be an example of that, or the tendons or ligaments or whatever. So anyway, so that's soft tissue, and those are three categories. To determine between all three categories as to why your dog is limping, number one, it's going to be based on the history that you're presenting to the veterinarian. Number two, it's going to be based on what your veterinarian finds on physical examination. And number three will be diagnostics to confirm or rule out the suspected diagnosis. Keep in mind, these three categories are not a diagnosis, right? You can say, I think it's orthopedic in nature, but it doesn't tell you why your dog is limping. Is it the hip? Is it the elbow? Is it the neck? All that says is that I think it's coming from the orthopedic system, the skeletal system, and we have to figure out exactly where is the discomfort or the disease located, specifically, what are the possible diseases that can affect that portion of the body in a species of that nature, of that age, of that sex, of that weight, of that breed. And that's how doctors narrow things down. They first decide anatomically where the problem is, and then from there they start to fine tune it to where they go, okay, it's coming from not just the knee joint, but it's actually the cranial cruciate ligament that we suspect is the problem, right? So you start off with, why is my dog limping more broadly? And let's say in the left hind leg, okay, the doctor determined it's orthopedic. Then they determined based on examination and diagnostics, it's orthopedic, and it's coming from the stifle joint, the knee. And not only that, but within the stifle joint, it's coming from the cranial cruciate ligament, the CCL, and we suspect that it's torn, and that's why your dog is limping. And you see how that narrows it down. And you do the same thing for soft tissue, same thing for nervous system. And this is useful information for veterinarians who are just starting their career or vet school to have, because this sort of makes what seems to be very complex case of limping, because it can be so many different reasons for limping, and then boil it down to some basic parameters. What you can expect from your veterinarian, theoretically, ideally, perhaps, depending on the scenario and their experience, is of course an examination in person. Secondly, probably blood work. They're gonna look for anything that's wrong internally, and also if your pet needs sedation for X-rays, for example, or joint taps, which is called arthrocentesis, or whatever, CT, MRI. Then they want to make sure that your dog, your cat, is healthy internally based on blood work to undergo sedation, anesthesia. Okay. Then from there, they may have the answer, and they're like, okay, I suspect it's disease A, Or they'll say we need further investigation, in which case now you're going up the chain of diagnostics. Radiographs or X-rays are the most common starting point for trying to figure out what's causing the issue. And radiographs, for example, are great for orthopedic, so for bones and joints, not great for soft tissue, and almost useless for nervous system. Whereas a CAT scan, a CT scan, computed tomography, is a little bit higher up on the scale of cost and fanciness for diagnostics. Very good for bones, much better than X-rays for soft tissue, definitely can be used for nervous system. And then magnetic resonance imaging, or MRI, is not great for bone, but can be used for bone, but it's phenomenal for soft tissue and phenomenal for nervous system, right? So those are just some examples. You can say ultrasound is another tool you can use to look for limping. It's terrible for bone. It's okay for joints. It's great for ligaments and tendons, depending on the area of the body. It's great for soft tissue, right? So all these tests have different pros and cons to them. And of course, they come with different price tags. And of course, they come with different requirements for sedation or anesthesia or completely awake animal. And it comes down to availability. Maybe an MRI or a CAT scan is the best for your pet, but you can't afford it. Or the nearest MRI is a referral hospital that's 1 hour away. And they're booked out for weeks or months. So then you settle for X-rays with your vet because it's better than nothing. Hey, 2 audience members. Thanks. Hi. Thanks for joining. So the diagnostic plan will depend on what you can afford as a pet owner, what's available to you, what your veterinarian thinks as far as prioritizing these diagnostics. And that's what you can expect when you go to the vet. From there, let's say they have a diagnosis. What's the treatment? Treatment options. Well, treatment is in 2 different categories: medical management and surgeries. Sarah Helms, hi, with a wavy hand. Hello, a returning guest here at this very popular live stream. So medical management is what that is. It's medical management. It's medications, but also physical therapy, acupuncture, laser therapy, ultrasound therapy, et cetera, versus surgery, which is surgery, right? So in making an incision, cutting into the patient to fix something. And it can be a combination of both. Usually, if you're performing surgery, it's going to be medical management on top of that, because the patient is going to need antibiotics and pain medication and all that stuff on top of it. But not every condition requires surgery. Not every patient is a surgical candidate. Not every client can afford surgery or ethically wants to do surgery on their pet. And so it depends. Or surgery is not an option or whatever. So you can imagine that with the broad array of diseases that are possible, orthopedically, soft tissue, and neurologically, the types of treatments that are out there are going to vary widely, right? And it depends on the case, of course. Not every case gets the same treatment. It depends on the diagnosis and the specifics of the case. And not every injury, although the same, warrants the same treatments. You may treat a cruciate ligament tear in a 2-year-old dog differently than you would in like a 16-year-old dog, right? So it all depends, and you need to have a discussion with the veterinarian, pros and cons for all these treatment interventions, what you want to do with your pet, knowing the pros and cons, and then you make decisions and go from there. And then the next phase of your vet visit, as you should expect, is going to be a recheck of some sort, find out how your pet is doing after you've hopefully followed through with the veterinarian's recommendations to the best of your ability. And that recheck will either say, great, keep up the good work, we're done treating, this problem's resolved, or okay, a little bit longer, we need more time, or we're not doing well, and now we have to consider other diagnostics or other treatment options depending on what you want to do, what the case entails. And that's your recheck. And most rechecks are going to be 10 to 14 days, but it depends on your veterinarian and all that stuff. But that's what you can expect from your vet. And long-term follow-up depends on the disease. If you have a puppy that fell off the couch and is limping, one recheck is probably even overkill, but it's sufficient. If you have a dog that's had spinal surgery, you're probably looking at 3 to 4 months plus of rechecks with your veterinarian for that dog, depending on how things are going and everything in between, right? So it just depends on what the situation calls for, But most of the time it's 10 to 14 days to follow up with your vet and see how things are going. So and I think that probably covers it. The important takeaways here, especially if you're watching this as a veterinarian, a new graduate, a vet student, etc., is your history matters a lot to figure out which of those 3 categories of limping it is. Your physical examination needs to be thorough. You need to find the source of discomfort or instability or swelling or whatever it is. And then that's your anatomic diagnosis, broadly speaking. And then you want to narrow down the anatomic diagnosis to exactly what part of the body is the problem. That's based on diagnostics. And then from there, treatment depends on what you end up finding. So I hope that is useful for folks, and feel free, please subscribe, donate, share, hit like, all the things. Sarah Helms asks, what does a physical examination for limping entail? Great question. So physical examination, of course, is going to be manual manipulation of the patient. The veterinarian ideally would manipulate every part of the body that could potentially cause limping, which is going to be every part of the body, mostly external stuff, but it could be internal as well, things they don't have access to. But the physical examination is going to be based on palpation. So they're going to feel the muscles, look for symmetry, look for atrophy, look for any swelling, tumors, growths, sources of pain. They're going to palpate the joints. So extend and flex the joints, see if there's joint swelling. Is there crepitus, which is like a cracking sensation you get with like arthritis and other conditions? Is there any pain associated with that? Do you have normal range of motion of the joint that you'd expect for that species, that age? And then they're going to do neurologic testing as well, which is part of the physical examination. They're going to check your dog or cat or whatever for reflexes, proprioception, their mental state, how are they walking? Are they limping or dragging or weak? And so that's just some of the details for a physical examination. It's way complicated, or complex rather, but an experienced veterinarian can perform this entire physical examination fairly swiftly. And the more experience you get, the more you can narrow down. If the dog is limping on the left pelvic limb, I'm not going to spend that much time on the neck, the spine, the other legs, right? Because the limping is left pelvic limb. So we're going to focus in on that. So I'm going to do a cursory examination on the other parts, but then do a deep dive into that left pelvic limb and find out, okay, is it lower back, so lumbosacral? Is it coxofemoral joint or the hip? Is it the knee or stifle? Is it the tarsus or ankle, etc.? And so that's how the vet will follow through the physical examination. The history and the history, the historic findings are going to kind of tailor where the veterinarian needs to spend most of their time. And then the more complicated cases, take a doctor that's a bit more experienced and says, this physical examination isn't matching up with what the pet owner is saying. Something's off here, maybe more to the story. So Sarah Helms also asks, thank you. Is it usually painful for animals to be physically examined? Yeah, part of the goal with the veterinarian is to find out where the source of pain is. And luckily, animals usually, unless they're very stoic, will vocalize that. Even animals that are very stoic, that don't respond to pain, you can usually tell their pupils dilate when they're in pain, their heart rate goes faster, they start panting or stop panting, they stop wagging their tail, they start wagging their tail. You're looking for like subtle hints if the dog isn't obviously yelping or whimpering or whatever in pain. But yeah, finding out if your dog is painful and where is part of the process, because they don't talk to us. They don't come in and say, hey doc, my elbow hurts, what do you think? They just come in with limping and they don't say anything, and the pet owner speaks on their behalf and you have to figure it out. So usually I'll tell pet owners, I apologize if he screams or he yelps or whatever, and that's just the nature of the business. That's what. Now some pets, when you get really experienced with it, you can tell, and you don't need to repeat. The pet owner might have a video showing the pain, which is good enough for me, or you have a dog that's like sticking its neck out like this, and when they turn, they don't even move the neck. That's neck pain. I don't need to make that dog scream. That's excruciating pain. There's no point to that. But most cases, it's kind of nebulous, and you need to like pinpoint exactly where the discomfort is coming from. And pain is a pretty consistent clinical sign of lameness for any reason, soft tissue, orthopedic, or neurologic. There's usually pain associated with it. Not always, but usually there is. And so you're going to try and elicit some sort of discomfort from the pet to figure it out. Great question. All right, everybody. Thanks. That'll do it for this live stream. Thanks Sarah for your excellent questions and for attending. Thanks everybody who watches on the playback, and heart emojis or whatever, floating hearts. Thank you. It's a lot of hearts, Sarah. Jesus. It's a lot of hearts. I wish those hearts turned into likes. Maybe YouTube would pay me for this. Okay. Thanks, everybody. I'll see you guys tomorrow, July 31st. It is a busy day tomorrow, but I'm hoping to do an early stream. Because if I don't do it early, it's going to be like late night. And I prefer to try it in the mornings, unless people tell me that they want late night. I don't know. Okay. Take care, everybody. Bye. Bye, 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 bye.